Chicago Tonight, Latino Voices is made possible in part by Allstate and the Searle Funds at the Chicago Community Trust, and by the support of these donors.
Good evening y bienvenidos to Chicago Tonight, Latino Voices. I'm Michael Puente, reporter with WBEZ Chicago. Thank you for sharing part of your weekend with us on the show tonight. With Omicron on the wane, we'll hear from public health advocates on the state of COVID in the Latino community. Did city leaders do enough to protect Little Village from the demolition of the Crawford power plant? An Inspector General's report claims massive city failures. They say that getting older isn't for the weak. We'll talk about how Illinois can make aging easier and more equitable for all.
We know the language, we know the culture.
And a student news outlet celebrates its second year of covering Chicago's Latino communities. First off tonight, we're about to enter the third year of the COVID-19 pandemic, and with the news that the Omicron wave has passed its peak in Chicago, a light begins to appear at the end of the tunnel. But public health advocates are warning the city's residents not to let their guards down just yet. Joining us now more are Lucy Flores, Director of Community Engagement at Esperanza Health Centers, Dr. Geraldine Luna, Medical Director at the Chicago Department of Public Health, and Dr. Juanita Mora, Allergist and Immunologist at the Chicago Allergy Center. Welcome all of you to Latino Voices. All right. We'll start off with you, Dr. Luna. As we approach the start of our third COVID year, what would you say is the biggest problem facing the Latino community right now?
Yeah, and thank you, Michael, for having me. And I think that the biggest challenges, the most powerful challenge right now in vaccinating our Black and brown communities is accessibility. Structural barriers is something very important that we still work very hard from the city side and folks with the community in collaboration with community leads to reach out to those communities, but also hesitancy. And we see that media has played such an important role in inflicting fear to our communities and mistrust in governmental systems and health and the systems in place that we have, perpetuating even further the disparities that we already see and now with vaccine coverage. So all these conversations and collaborations and initiatives are to target and see how we can bring down barriers, individuals not having health care, individuals not trusting with health care, our undocumented community. So there is so much still to work with, and this pandemic has been like a learning lesson throughout the way, a lot of moving pieces, Michael.
Absolutely. And Dr. Mora, what are you hearing from parents reluctant to get their children vaccinated?
Sure. Hi, Michael. Thank you for having me. But what I'm hearing a lot is a lot of fear. So a lot of them are actually stating, well, Dr. Mora, it's a brand new vaccine. How do we know that it's not going to have long-term side effects? Do we have studies to show that there's no long-term side effects to it? And what if it affects fertility? Two of the biggest fears that I hear. How I combat it is really mRNA vaccines have been around for 25 years, and there's studies with other viruses looking at, long-term sequelae, which there have not been, and no actual problems with fertility in actual little girls or little boys. But it's a lot of misinformation in social media that we need to combat with a lot of truth and a lot of good source information.
Lucy Flores, do you think the CPS return affected infection rates?
I'm not an epidemiologist or a clinician, so it's really hard for me to speak on any of that specific data. If I were to, want to speak from a data perspective, I think that what we can focus on as far as CPS, I think that there are really great opportunities to work with CPS and community-based health centers to facilitate access to vaccines and to work with some of the parent groups, work with CPS staff, and engage our community members from every angle in order to connect them to community-based health centers in their areas and create hubs where parents can access vaccines. So I think that not getting too political, but I think that there are definitely opportunities with CPS and similar community organizations that work with our families for health centers to connect with them and make registration easy, connecting them to resources and connecting them to availability. At Esperanza, we definitely are currently able to vaccinate individuals with same-day appointments, and also obviously try to coordinate with families so that it works with their schedules.
Well, Lucy, staying with you, so do you feel that CPS isn't doing those things right now, that they're not doing enough of that in trying to boost up those vaccination rates?
I don't know if I'd say that they're not doing enough. I think that we could always do more. Looking at our data and the numbers that I am familiar with, I do know that our Latino youth in some of our Latino specific communities are definitely lagging in vaccination rates. And so I think that working again from every angle and targeting every organization, including CPS, to work together to increase vaccination rates. I would definitely say that we could all be doing more to work through different channels in order to get our families and children vaccinated. And to both Dr. Luna and Dr. Mora's points, I think that there's definitely more that we could do in order to create access, if access is what we're hearing that families are unaware of. And also, targeting messaging. How can we improve our messaging and communication in order to inspire more confidence and trust in families about the COVID vaccines? I don't necessarily think that people are anti-vaccines. I think that to the points that have been made, families are concerned about side effects. And so how can we have conversations with our families on that topic?
Well, Dr. Luna, your colleague, Dr. Allison Arwady, said indicators we're past the peak of Omicron. What are you looking for over the next few weeks to know we're on the right path?
Exactly, Michael. We need to see those steady numbers, not only peaking, but downtrending. And that is exactly what we've been seeing these past 3 weeks. So we're very optimistic, but cautiously optimistic, and making sure that the most important thing, hospital systems are not saturated or strained, because those still, the capacity is somehow limited, never to the point that we have to activate contingency plans and, like we had McCormick putting beds and activating to that point. And it seems like it's not going to be necessary because cases are going down. And one of the positive things, and you're right about Dr. Warwoody's and the Department of Public Health predictions, which align nationally with the predictions and the numbers that we're seeing right now, is that Omicron started very quickly. It was like the variant, the last variant, a dominant variant that we have right now, like skyrocketing in those cases. And as fast as it went up, it seems like this is how it's coming down. It's doubling the rates and decreasing cases. We're seeing in all metrics, all our health indicators, hospitalizations. We're seeing in cases, hospitalizations. We're seeing in test positivity, which aligns and have reflected that what we're seeing is actually truth. And now we are also seeing death has been decreasing. So most important thing, Michael, let's have our community vaccinated. Let's see if we can stop the mutations of this virus at this point and take advantage that we're moving out of the surge and looking more to those numbers and more control of the disease to bring back our livelihood.
Well, Dr. Morton, we only got about 30 seconds left. Dr. Arwady also said this week that vaccination rates among Latinos are about even with white Chicagoans. However, booster rates among Latinos are lagging. What do you think is behind that?
I think it's vaccine hesitancy. So I think we need to hold more town halls to really get into the community, talk to all the people, show them the importance, show them the data on why actually getting boosters is so important amidst the Omicron cases to keep our families, our community, our nation, and our world protected.
Well, our thanks to Lucy Flores, Dr. Geraldine Luna, and Dr. Juanita Mora.
Thank you, Michael.
Thank you.
Thank you.
There are renewed calls by Southwest Side residents for action from the city over the smokestack implosion that spread a cloud of dust over Little Village almost 2 years ago. This after a new report from the Chicago Inspector General's office concludes city employees and the company involved should have faced tougher consequences for a lack of oversight leading up to the demolition. Chicago Tonight's Joanna Hernandez spoke with residents about this new report and issues that go beyond just this one event.
Kind of a big, whatever to the people that live here, like, who cares? I know that even before the plant got taken down, a lot of the residents developed upper respiratory issues.
This is an image residents of Little Village may never forget. Gaspar Mesias lives right next to what is now a Target warehouse and watched the massive shadow of dust blink at the neighborhood.
Sé que si ellos cobraron miles de dólares de multas y la gente que vivimos aquí, pues aquí no nos tocó nada. Y aquí, si usted ve, aquí donde está aquí, en mero frente estaba la torre.
In April 2020, Hilco Development Partners demolished the former Crawford power plant. Neighborhoods on the southwest side were left to deal with the aftermath. Now, an investigation by the City Inspector General's office contends that the Department of Health should have terminated one official, and the Department of Buildings should have disciplined 2 others directly associated with the implosion. That has not happened, but to some, simple employee discipline would not be enough anyway.
Be accountable to the actions that you did. Like, firing somebody is not going to tell us what's in the soil. Firing somebody is not going to fix the fact that individuals chose to not give information. Individuals chose not to follow up on things. And all they get is a reprimand.
Kim Wasserman, executive director of the Little Village Environmental Justice Organization, was one of many who tried to stop the demolition. Now she wants the mayor to release the full Inspector General's report.
We have no idea what we were exposed to. We still don't know what is in the soil a year and a half later. And so I think that's what Hilco needs to be putting up money for with the city, is to tell us what were we exposed to. Can we do anything about it? Hilco should be putting air filters in every single person's home that was in that area. There's more trucks because of their development. They need to be responsible for that and so much more.
The report found those in charge had more than enough warning of potential hazards, in fact 213 days before the destruction of the power plant, and said that toppling the smokestack would be a disaster.
I think the IG laid out what potentially that would be, and I think the city's fallen short so far.
The report is critical of the oversight of the project leading to that day. It claims officials of the Department of Public Health and the Department of Buildings approached their regulatory roles and responsibilities in not my job fashion, rather than taking affirmative measures to meet the public health and safety risks at the core of their respective departments' missions. Alderman Michael Rodriguez of the 22nd Ward says the report leaves him wanting to know more.
My neighbor's been fighting against a former polluter that was there in the energy company. Now they've had this dust storm on them. What's been given so far has not restored the justice that's deserved to the members of my community, to my neighbors, the people who live down the street from me.
The report by the Inspector General concluded by claiming city officials ignored the red flags and information provided to them that the demolition posed a high risk of environmental harm to the neighboring Little Village community, calling out the city for poor public administration and negligent dereliction of regulatory responsibility. So far, a Department of Health official has been reprimanded, and the Department of Buildings has claimed employees did not violate any rules.
As a matter of fact, I don't know if they'll ever be able to do enough to restore full justice to our community. Hilco needs to do more. I thank them for giving Access Health some resources.
In a settlement, Hilco and its subcontractors were required to pay $370,000 that will go to Access Community Health Network to support a project called the Little Village Community Health and Wellness Program. Hilco and its contractors were also hit with multiple citations, resulting in $53,500 in fines. But for activists like Wasserman, this is just the beginning of a long road ahead.
The scars of what that day has done to our people is no amount of money can fix what happened that day. But best believe that we're going to continue fighting for our neighborhood because we are worth it.
For Chicago Tonight, Latino Voices, I'm Joanna Hernandez.
We reached out to Hilco for comment, but they have yet to respond. The Chicago Department of Public Health says it has adopted new policies for future implosions, but disagrees with the Inspector General's findings with regard to any employee acting in a negligent manner. And thus far, Mayor Lightfoot has declined to release the full Inspector General's report. Back with more right after this. For those of us fortunate enough to reach an advanced age, existing inequities can magnify the challenges that come with aging, that include access to social services and healthcare and broken social connections. And for Latino seniors, issues of language access, health inequities, lower incomes, and documentation status can make the daily business of living even more complicated. The activist organization Health and Medicine Policy Research Group has started a campaign for aging inequity called Illinois Aging Together. The campaign aims to develop a strategic action plan for aging in Illinois. Joining us now with more are Sandy Pastor, the Health and Aging Policy Organizer for the Health and Medicine Policy Research Group, and State Representative Barbara Hernandez, whose Western District includes Aurora. Thank you to both of you for joining us here on Latino Voices.
Thanks for having me.
Thank you. Well, Sandy, we'll start with you. Your group says they're hoping to reframe how we think of aging. What does that mean?
So it means, looking at how we think about aging across our lifespan and across our life course, and how often we are impacted by ageist messages and ageism, and how that creates a barrier to our own aging and how we think about aging and perspectives about aging. So we want to reframe it in a positive framework that we know, many older adults as they grow older find that aging is really good. They underestimated the older years. Mm-hmm. And so we want to make sure people understand that it's a good thing to age.
Well, Representative Hernandez, what challenges are seniors, particularly Latino seniors, facing right now that this initiative is seeking to address?
I think, as you mentioned earlier, there's a lot of different obstacles that families face. Not knowing the language is very difficult. Many of those families also don't have health insurance, have not had health insurance for pretty much all their life here in the United States. So it's very hard for them to even try to get medications, to find services, resources, or even know what's available to them when it comes to their health concerns. And that's why we were able to pass a bill inside the state budget that allows undocumented families from 55 and over to receive Medicaid. And now, for the first time ever, families are actually receiving health care.
Wow. Sandy Pastor, does where you live, urban versus rural, make a difference in what you experience as you age?
Yes and no. We found that in the urban areas, in the rural areas, there are some of the same things that are coming up, like transportation, healthcare issues, access to nutrition, grocery stores, and all kinds of things that improve quality of life. And that's true in both the urban areas and in the rural areas. And we also found that the cost of living, while we might think of urban areas as more costly and housing as more costly, it in fact is almost about the same when you look at the numbers, because the cost of health insurance rises in the rural areas due to density of population or lack of density of population.
Sure. Representative Hernandez, are there cultural barriers or elements that complicate getting care or assistance for Latino seniors?
There are. I think there's a lot of them that we need to be able to face and come forth and educate each other. Personally, for me, I have a grandma back in Mexico that currently is dealing with dementia. And unfortunately, I can see that difference between my family, that instead of saying, hey, your grandmother has dementia, they keep saying, oh, she's forgetting a few things. It's the age. And that's not what it is. We need to be able to acknowledge what the doctors say and that it is dementia, and be able to find ways to help our family members or caretakers as well. So there is a lot of different things that we need to do in the Latino community to be able to face those barriers, but we need to talk about them. We need to normalize them a little bit more in our discussions and not avoid it or not label it as because of mental health that someone is crazy. That's not the case. They need a little bit more assistance when it comes to their health care. And that's something that we really need to address with them. And hopefully we will get to that point where the Latino families feel more comfortable discussing certain things that are taboo for them.
Well, staying with that, Representative Hernandez, is there sort of a stigma in admitting a family member may have dementia?
I think there is a stigma. I think they're scared of the unknown, not knowing what exactly it is. Also, how much is it going to cost once it actually a family is faced with that reality? Is it going to cost me more? Is it something I'm able to help them? As you probably heard earlier, it was just a lot of transportation, medication, not knowing what they can do with the resources they have. And there's still a lot more families that don't have health care. There's just a few of them, but we hope to create more policies that can help the Latino families and the minority families in the state of Illinois.
Well, Sandy Pastor, we only got a couple of minutes left. What resources are currently available for Illinois seniors and caregivers who need help?
There are a lot of resources through the area agencies on aging. There's 13 regional area agencies on aging that fund all kinds of caregiver services and Older American Act services like nutrition, congregate meals, home delivered meals, caregiver support, and things like that. And then there's also programs through the Illinois Department on Aging. It's called the Community Care Program. And that helps provide homemaker services, adult day services, automatic medication dispensers, and emergency home alert systems. And they are adding some more services to that Medicaid waiver service. The problem is, while we did pass a legislation supporting Medicaid for immigrants last year, what is not covered is the CCP program. So these home and community-based services that are Medicaid waiver services are not available to everyone, and they're means tested.
Well, our thanks to Sandy Pastor and State Representative Barbara Hernandez. Up next, checking in with a Spanish college newspaper at its 2-year mark. Stay with us.
Don't ever miss Chicago Tonight. Subscribe to our podcast. Get a daily download of our show delivered to your desktop or mobile device. Go to WTTW.com/Chicago Tonight podcast and subscribe.
The latest census revealed a growing Latino population in Chicago. That makes journalism that not only tells the stories of the Latino community, but speaks to them in their language more important than ever. In January 2020, student journalists at DePaulia University launched DePaulia, a Spanish language platform reporting on DePaul's and Chicago's Latino community. We spoke to editor-in-chief and co-founder Maria Marta Guzman and managing editor Erica Perez about the young news outlet's first 2 years and their hopes for the future.
The reason why we started La DePaulia and why it was launched was because we felt that there was a need for Latino voices to be heard, and specifically in Spanish. So we wanted to create a platform. There wasn't a platform here at DePaul, so we took the initiative to create it. We know the language, we know the culture awareness. So I think that's what makes it so important, is to have the proper, accurate representation of our community.
A lot of the people that I interview, especially like on topics like about education or the workplace, a lot of the people I come in contact with speak Spanish, and just like their first reaction, or just like when I tell them about myself and what I'm doing, like they say, oh, I like thank you for you talking to me about this topic, because I feel like a lot of people don't know about it. A college community is so diverse, so them knowing about what the Latino community is like here, is very important.
We are really trying to aim and advocate for this to become a course with another Spanish publication here at DePaul. called Pueblo. But our mission is for this to continue even after we are here. So definitely just doing a lot of groundwork and making sure that we can leave a strong foundation for the next generation.
DePaulia also launched a podcast this month. You can find more about that on our website. And that's our show for this weekend. Be sure to check out our website, WTTW.com/news, for the very latest from WTTW News. And if you're watching us on Saturday night, know that you can also catch Latino Voices and Black Voices on Sundays beginning at 10 p.m. And don't forget, you can catch my reporting on 91.5 FM WBEZ. Next week on Latino Voices, Alex Hernandez from Univision will be here in the host chair. Now, for all of us here at Chicago Tonight Latino Voices, I'm Michael Puente. Thank you for sharing part of your weekend with us. Stay healthy, stay safe. Buenas noches.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that supports free educational initiatives in the legal profession.